So for our next panel, we have it's entitled "What to Look For in Selecting a Residency Training Program." So again, I'll give a 2-minute warning before the closing of the session, which will be at 10 o'clock. And we have, again, some pre-prepared questions that we will be asking to get the discussion started, and we'll also be taking some questions from the chat as well from the audience. So on our distinguished panel today, we have, and if you just want to turn on your video and wave and say hello as I say your names, just to introduce yourselves. Dr. Chirag Patil, Chair of Neurosurgery at Cedars Sinai.
I'm actually the program director, but you know, maybe in the future. Thank you.
Oh, sorry about that. We must have gone to mix up there.
Unless you got a memo that I didn't get, you know, just let me know.
My bad. I'm so sorry about that. Program director at Cedars Sinai. Dr. Alexander Khalessi, Chair of Neurosurgery at UCSD.
Good morning, everyone.
Dr. Marvin Bergsneider, Neurosurgery Residency Program Director at UCLA.
Good morning.
And Dr. Susan Durham, Professor of Clinical Neurosurgery at USC and Chief of Neurosurgery at CHLA.
Morning. Nice to see everyone.
And Dr. Kiarash, Shahlai, Neurosurgery Residency Program Director at UC Davis. Welcome and thank you so much. Oh, sorry about that. Welcome and thank you so much today for joining us. Our first question is there an ideal threshold to determine whether an institution has a large enough caseload? And how important is it to have earlier independence in the operating room?
Well, you know, I'm happy to kick things off. First of all, congratulations and thank you for arranging this session. It's as someone who's spent my life in academic neurosurgery, it's heartening to see the future and such an exuberant response and interest on the part of the medical students. In terms of evaluating your the adequacy of your surgical training, I just want to be clear that all of the programs that you're having exposure to today will give you excellent technical neurosurgical training and will absolutely provide you the fund of knowledge you need to provide the best care for your patients. In evaluating your own training experience, though, I think it's helpful to look at the breadth and depth of neurosurgery, particularly if you began to develop a specific subspecialty interest. It's my own feeling that each of you should approach your resident journey as your first best opportunity to get exposed to each distinct subspecialty, and so to come in very much with an open mind. And you should know, because few people have line of sight to these opportunities, that the folks at the Resident Review Committee at the ACGME give a lot of thought and deliberate attention to the accreditation of programs. And so in evaluating that overall experience, instead of looking for an absolute number, I'd encourage you to look at the cases that are completed by the graduating chief residents and their technical comfort level in the operating room and ultimately the positions that they're able to achieve. Because if you have a program that's accredited and in good standing, there's no question you're going to have an adequate substrate to become the surgeon you want to be.
Alex, this is Marvin. I agree 100%. You know, what we all give presentations when students come to visit us, and I like to talk about there's the numbers, but if you have 5,000 spine cases and 10 cranial cases, those numbers actually don't really count. So you have to have adequate numbers to learn. There's no substitute for that. You have to have the substrate there. But as you said, you need the breadth. So you want to learn all different types of neurosurgical operations. And then I think you have to have the autonomy and that quality of education. So watching 5,000 cases is no substitute for, you know, if you have a place that has 2,000 cases and you get to do those 2,000 cases, you're going to get a much better training. And I echo the last part too, is that when you want to subspecialize, and most residents want to subspecialize, do you have then the depth to go and both on the research side and on the clinical side? So I agree with you 100%.
This is
Thank you
Shahlai
so
from
much.
UC Davis. I mean, I also completely agree. It's, I think when you visit programs and get to know programs, they'll often share with you graduate data, which is always interesting. But I think really talking to the residents and understanding what is the quality of that operative experience, as Dr. Bergsneider said, is so important, because you don't want to just be in a program where you're going to log a bunch of cases, but not have that ability to really learn how to do those cases well. And the question about independence is an interesting one, because it's appealing to be independent, but you really have to develop that well. So I think you really want to talk to the residents and understand, do they have a good relationship with the faculty? Do they feel like they're being coached well? So when they get to that point, they're not just being thrown, into a situation that they feel uncomfortable with, but they really get to that level of independence when they graduate.
I think the second half of the question was about early operative experience, and people may feel a little differently this way. I think in the short term, it does seem like, it's really nice to have that, and it may be really important, and certainly something that's sort of enchanting, and many people ask me about that. I think in the overall scheme of things of 7 years and 30 years of career, it probably doesn't matter a whole lot, in my opinion. I think different programs are structured in different ways, and they have different strengths, and so they figure out how to train the residents to the best of their potential. So I don't think it's a big factor when I'm thinking about things during my education, or when I've trained residents. It's nice to have that early experience. But I think in overall scheme of things, it probably doesn't matter in the long run. So I wouldn't worry too much about it. I think a lot of people like to talk about it. And if there's a program that you really like that happens to have it, great. But again, I wouldn't put too much weight on that.
Great. Thank you, doctors, so much for your valuable input on that question. Our next question is, what are some characteristics that applicants should look for, particularly on interview day? I know we emphasized in our previous panel that meshing well in terms of personalities is important with the residents and faculty. What else would you advise medical students and applicants to look for on interview day?
I mean, that Kevin, it's a great question, but it's a long list. I mean, ultimately, this is going to be a formative chapter in your education and your professional lives. And, when you're evaluating a residency program, in my mind, there are kind of three distinct categories of criteria that you should think through. The first, and we touched on it in the initial response, is kind of the fund of knowledge and technical education and exposure to the broad range of subspecialties, and obviously making sure that the institution has the capital facilities to support that in terms of infrastructure, that you have an exposure to bleeding edge technologies and neurosurgery. The second, in my mind, the culture of the faculty is very important in terms of treating residents and medical students as folks who are just a little bit further behind in the pipeline, but are no less their peers in the future of the specialty. But the esprit de corps among the residents in particular is extraordinarily important. And that's not just how they interface professionally, but whether they spend time together personally. Because there's no question, I was fortunate to have Gabby Zada as my co-resident in residency, and I can tell you, I learned as much, if not more, from him than I did from the faculty, with no disrespect to Dr. Giannato. And so who you're training with is really, really important. And then the last piece, and I think it's something that's underemphasized, is the reality is that there are only 3,000 neurosurgeons practicing nationally and only roughly 150 training at any one time. And if you look at how neurosurgery was practiced 30 years ago with respect to today, it's a complete sea change. And that really required a substantial attention to detail and commitment to craft from a small group of people. And so as residents, it's really one of the last times you have dedicated protective time to advance the field in a particular area of neurosurgery in which you have interest. And so making sure that that research infrastructure is also in place and that you can identify appropriate mentors and start to think about the sort of questions that you would want to answer, I think is an extraordinary underappreciated criteria that folks should be thinking about in looking at programs.
Thank you, Dr. Khalessi.
I'm not sure there's a lot to add to that. I think Alex pretty much summarized it. I would, I think in the first session, someone, Dr. Lim, I think said that 7 years is like a marriage. Coincidentally, I think that is the average age of a long length of a marriage in California is 7 years, unfortunately. But it is a full commitment, and you really want to be at a place where you're going to feel welcome and blossom there. Because if you're there and the faculty and the residents that don't mesh with you, it's going to be a long schlep, because it's a tough 7 years. There's no doubt about it, and it's tough for a good reason. It's a serious profession, and I think Isaac really summarized it. It's amazingly hard, but amazingly great. It's so rewarding. I do want to add that we call Isaac the GOAT too, but I didn't realize that's what it meant. Just kidding, Isaac. You're great. You're awesome.
So if I could chime in, having been in a place that's UVM for 7 years with 1 resident a year, and now at USC with 3 residents a year, it's a very different flavor of a program depending on the size of the residency program. And so different residents tend to fit better with different types of programs. So programs where there's 1 resident a year tend to be a very close-knit program, and interpersonal relations and how you get along with the residents and the faculty are super important in a 1 resident per year, because you're such a very close-knit team together all the time. If you're the type of person that really likes to kind of be around a lot of people and spend different times at different rotations all through your residency, then a lot of times the bigger programs where you may only spend 3 to 6 months at any given place with any given resident tend to work better for those types of personalities in resident applicants. So you really have to kind of look at the size of the program and also sort of the overall feel of the program. And this year is going to be tough because it's hard to get that feel of a program without a personal visit there and being able to talk to the residents, because I totally agree that the resident interactions with each other is such an important factor when looking at a residency program, because you can tell the residents that are happy, that love to be there, they're friends with each other, they do things together, versus the programs where residents are fighting and there's really kind of this really negative energy in the program. So it's going to be something to do your homework with this year, and to as much interaction as you can get with the residents during the interview and the application process is going to help you sort of figure out the program that's going to be the best fit for you.
Great, thank you so much, Dr. Durham and Dr. Bergsneider. And so our next, does anyone else have anything else to add? If not, we can move on to the next question. Great, so our next question is, how should applicants take into account diversity, both in terms of race and gender, amongst programs, faculty and residents?
I'll take that. I think diversity is really important. I mean, I think the West Coast programs probably have more diversity as gender and race and those sort of parameters. But I think what you really should look at as well is diversity in teaching styles and where the teaching faculty have come from. So that's really, I think, the rich diversity that personally I would focus on if I was applying. There's some programs where the faculty have trained in this same program. And I think the disadvantage of that is, everyone does sort of things the same way. And I think if you look at programs that have recruited people from many different places, you get a flavor of doing the same thing a different way and see what surgical technique works for you the best, and mix and match between your attendings on little tricks that make up the art of neurosurgery. So I think that diversity of knowledge and teaching styles is really important. Some programs will say, well, we just make, students and residents have all the autonomy that they want. And that may not be a good thing, because you want to actually know how to operate and how to operate well. So you want attendings that are obviously very good surgeons that can teach you how to do an operation well. And then, and they may be very hands-on, and that's okay, as long as you have some attendings in the program that are more hands-off, and you get to practice those things that you saw from, say, a master surgeon that maybe is a little more hands-on. So I think in a program, it's nice to have that diversity of knowledge, knowing that neurosurgery is an art. There's many ways to take care of a patient and do an operation and do it well. And diversity in decision-making as well. So that's, I think, key aspect of, what I think is important as far as diversity is concerned.
Thank you so much, Dr. Patil.
If I could just add, it said that the diversity, one thing that it adds is it adds to the overall education to everyone. And I couldn't agree with that more. One thing is playing the numbers and all these West Coast schools. That's one thing great about the West Coast. It definitely leans left, and because of that, it's a high priority. But I think it's a high priority for all the right reasons. And the inclusion of and being receptive to hearing opinions and experiences from a wide swath of gender identity, race, cultural backgrounds, all that adds so much more to the educational experience, and it really goes far beyond just neurosurgery, interacting with other patients, with staff. I think it's a great question, and it's something that I'm sure all of our programs take very seriously, and want to make sure that we have the widest diversity that we can.
Yeah, I couldn't agree more. I think what you're hearing as a resident applicant is that a diversity of thought and a culture where differences and various backgrounds are valued and respected. I think part of the spirit of the question, though, was if you identify with a particular group, should you seek out programs that have more people like you? And, the one thing I would personally hope for our specialty is that all of you are not just training as neurosurgeons, but you're training to be leaders. And a challenge that I often give to our medical students, residents, and fellows is this idea of leaving a place better than you found it. And I would hope if you were the first person from a particular group to matriculate into a given residency program, that you would bring with you that diversity of perspective, interests, and experiences that would make that residency program better, as Drs. Patil and Bergsneider mentioned. Because there's no question that we're living in an unprecedented time in terms of societal change. And one of the challenges in neurosurgical training is because the training period is so long, and because the opportunities to select residents are so few, you're talking about 1 to 4 spots a year. There is often a lag between when you actually see a change in the way society thinks about these issues and when you see a change in the composition of residency programs around the country. And to Dr. Bergsneider's point, there's no question that this is something that is desired. It's something that is going to be a great asset to our specialty. But it's also something that takes time because there's a lag in how these decisions over time change the composition of our specialty. And so if you are from an underrepresented group, I would consider it a missed opportunity. If you only considered the short list of programs where you felt like they had actually had the opportunity to train someone from that particular group in the past. Because I think those are the opportunities in particular where as a specialty, true diversity can occur. As opposed to a concentration in a subset of programs around the country. And I say that I'm as someone who's fortunate to lead a department that's actually quite diverse, but I would hate that value and that ethic not extend across all of our training programs. And it's partly a selection process on the part of the programs, but it's just as much a choice each of you are going to face as you construct your rank lists. And so I would hate if that had so much weight that we actually fail in our collective goal to diversify our specialty.
Thanks very
I can
much.
speak a little bit about
ahead,
gender. Yeah, about gender diversity. And Dr. Khalessi is absolutely right. It takes time. It takes decades. So we now have last year had the most female applicants that we'd ever had in neurosurgery. So 30% of our applicants were female last year. And if you look at numbers, and that numbers really tell things. So, you know, we used to be about less than 10% of our residency residents were females in the early 90s, and then now it's almost 20% of our residents are females. And then if you look across the lines of your career as you progress through, you know, your medical student, then you're a resident, and then you're an attending, you know, we tend to, female neurosurgeons, you know, it used to be thought that, you know, we didn't reach the academic pinnacle. So there were fewer professors of neurosurgery. You know, there was reports that females weren't board certified as often as males, and that, you know, there were fewer females in leadership positions. But over the last 2 decades, if you look at current data, we have just as many females in the lower ranks, like the assistant and associate professors, as males. And we're starting to get there in professors. And that's just really a function of time and the time that it takes to go through your career. Currently, if you adjust for years from residency graduation, there's no difference in academic rank or board certification anymore among our attending neurosurgeons. And we also have a lot more women in leadership positions that we've had. We have 5 chairs of programs, and we also have 8 program directors, and that's a lot more than we've ever had. So it's really in the last 2 decades that we've really looked at expanding gender diversity and diversity in general in neurosurgery, and we're continuing to make really, really good progress in that. So that's really one of the great things about going into neurosurgery in your generation, is that neurosurgery is really open to, you know, all the progressive changes that are occurring everywhere, particularly on the West Coast.
Thanks, Dr. Durham. I think this is a really important topic, and Dr. Durham is actually going to be joining us for the Women in Neurosurgery panel later on today as well, so we thank her for that in advance. I'm going to ask one last question on here, which is kind of a combination of some of the questions that have been asked on the chat, which is during COVID and without the in-person interviews and being able to see how everybody kind of interacts as a department, how are applicants supposed to get an idea of fit, especially without sub-Is at other institutions, or finding what programs across the country would be of interest to them to begin with to apply to without having any of these sort of in-person interactions? And then a follow-up to that is, do you think any institutions would have the opportunity to offer second looks later on?
Well, I think some of this is, we're sort of stymied by the senior society who doesn't want to advantage or disadvantage anyone. And I say stymied, I think the medical students, some of them may be stymied. These interactions, if you separate sub-Is from non-sub-Is, I think the interview process will not be a whole lot different, and in some ways somewhat better for the applicants this year, because I think the financial burden to you will be far less, and you can interview in theory with more people and more programs. I think it's up to us at our programs to avail our residents and our faculty to you during this interview process, which I think we're just going to have to do differently this year. We do it one way because we bring you physically to our program, but I think it's going to have to be more spread out so you have a better way to assess us through many different avenues. The sub-I issue, there's nothing we can do about this year. Maybe among sub-Is, there needs to be some, for all the sub-Is who do sub-I at their own program, a way to disseminate that information to other students. But this was my experience at my program, so they can learn from each other.
Yeah, if I can add to what Dr. Bergsneider said, I think it is an interesting year. It's going to be challenging for everyone. And I think the responsibility really has shifted to us as programs. We need to showcase our programs to you. We need to do a better job of letting you know what our program is all about, what it's like to train here, how our residents do, how our faculty are doing. And so I think we're going to do a lot of things virtually. We're going to do a lot of things electronically. I think a lot of programs are going to be looking at doing that, and that's going to play a big role. And maybe in the long run, when we go back to our more traditional models, it will actually be better off for having gone through this, because I think you're right. We've had really inherited a traditional model, and we do need to, I think, look at different ways to get that information to you. But it will be a challenge, and some programs will do probably a more effective job than others as we go through this learning process. I think trying to communicate is going to be critical. So I think as an applicant, you should feel free to reach out, contact program directors, contact chairs, contact residents, take that initiative, because I think we're all very open to trying to make this as easy and as open as possible.
Yeah, I'll second that. I think we're looking at sort of specific strategies on how we show you what our program has to offer. So I know from your perspective, it's a problem because you are not getting the flavor of all the different programs in the country. But if you're on this side, we actually have the same problem. We want to show you what are the things that we have to offer. So I think both of us have a common problem, and so I'm sure we're going to have to figure out a common solution. So one of the things that we're doing at Cedars is
2-minute warning. Sorry. Go ahead.
We just compiled a short video of our program and our residents and recent graduates on what their experience is. So we'll put that on the website. Hopefully other programs will do that. Other thing is we're planning to have some virtual sessions with the residents, that interested applicants or applicants that have applied to our program will have opportunity in small groups to discuss things with the residents, and perhaps we'll put on a couple of faculty panels if there's interest. So I think we're going to have a lot of touch points with you as the year progresses. Please, if you have any concrete suggestions on what we should be doing, feel free to reach out to me, reach out to us, and we would love to engage you in a forum that you think would be best. So I would love to hear from you.
Great. Thank you so much, Dr. Patil and Dr. Khalessi, Dr. Bergsneider, Dr. Durham, and Dr. Shahlai for joining us on this panel today. We have 1 minute left. And thank you, Jazz, for relaying all the questions in the behind the scenes in the chat. She's been answering a bunch of them via just typing them out. So thank you for that. Our time is up now. It's 10 o'clock, and I'll just hand this off to Jazz to introduce the next session.
Hey, everyone. everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.